Good morning, ladies and gentlemen. Thank you for coming to our presentation. First of all, let me introduce our team. My name is Samuel Ezra Christian as a moderator and first speaker. My friend Abdul Hamid as second speaker and Muhammad Haidar Fadli as third speaker. We are from Department of Pharmacy, Faculty of Medicine, Mataram University. So today, we talk about amphetamine. We have 5 subtopics of amphetamine. First, the definition of amphetamine. Second, history of amphetamine. Third, how amphetamine works. Fourth, therapeutic use. And the last part is amphetamine effect. The first subtopic is the definition of amphetamine. Do you know about amphetamine? Or the definition of amphetamine? Okay, I can tell you. Amphetamine is a distinct class of drugs that stimulate the central nervous system, producing an increase in alertness, wakefulness, and awareness. Amphetamine has EUPAC name and formula. The EUPAC name is 1-pennypropan-2-amine, and the formula is C9H30N. The second subtopic is history of amphetamine. Do you know amphetamine has a lot of history? Okay, for the first time at 1887, amphetamine was first synthesized in Germany by Romanian chemist Lazar Andalano, who named the drug phenylisopropylamine. And after 23 years, amphetamine was discovered by Berger and Daly. At 1927, this molecule was first synthesized by the chemist G.A. Les. And after that, at 1935, Smith, Klein, and friends introduced amphetamine to the market as a treatment for narcolepsy, mild depression, post-encephalitic, Parkinson, and a number of other disorders. Next, at 1937, experiments conducted on animals and humans by Ales and others clearly revealed the ability of methylphenethylamine to reverse drug-induced anesthesia and resulting arousal and insomnia. After 23 years, amphetamine abuse in the United States by motorcycle gangs. A notable part of the 1960s is mood subculture in the UK was recreational amphetamine use, which was used to full all-night dance at clubs like Manchester Twisted Wheel. Next, at 1965, United States Food and Drug Administration limited amphetamine to prescription use, but non-medical use made it common. Next, at 1997 and 1998, researchers at Texas A&M University claimed to have found amphetamine in the foliage of 2 acacia species native to Texas, a Berlanderi and a Rajidula. Next year, at 1999, substituted amphetamine used as historical been especially common among Major League Baseball (MLB) players. And after that, at 2006, the MLB banned the use of amphetamine. Next, 2010 until now, amphetamine can be consumed according to a doctor's prescription to prevent abuse. Okay, that's all from me. The next part will explain by my friend Abdul Hamid.
Okay, the first, I want to thank you for the moderator to give me a chance to speak. Let me introduce myself. My name is Abdul Hamid Mukti Ali. Alright, now I would like to tell you how amphetamine works. Okay, have you imagined how amphetamine works? Do you know how amphetamine works? That's a simple question, but complex answer behind that. If you don't know, now you know. I want to tell you. Okay? Alright. Amphetamine are stimulant drugs, which means they are speed up the message traveling between the brain and the body. Amphetamine increase dopamine and serotonin levels, the feel-good chemicals in the brain. Okay? Effect can be felt immediately, injected or smoked, or within 13 minutes, snort or swallow. Okay? Neurotransmitter sends message between the cell in your body to tell how to do things like everyone else. Okay? Amphetamine makes the central nervous system, the hard drive to the brain, and spinal cord work faster by increasing the amount of neurotransmitter. That's the rule, the works of amphetamine, right? That's the answer. Okay, the fourth, I would like to tell you about therapeutic use by amphetamine. Everyone also wanna know amphetamine is familiar drugs. Okay, amphetamine is a medication used in the management and treatment of ADHD, narcolepsy, also for the obesity patient. It's classified as a central nervous system stimulant. Okay. The first for ADHD or attention deficit hyperactivity disorder patient. For adults, use 2.5 for 5 milligrams a day. Dosage should not exceed 20 milligrams per day. For children aged 3 for 5 years, about 2.5 milligrams a day. The doctor can increase the dose according the patient needs. And the second for narcolepsy patient. Children over 12 years to adult for 10 milligrams a day, and the dose should not exceed 16 milligrams per day. Children aged 6 to 11 years about 5 milligrams a day. The doctor can increase the dose according the patient needs, like ADHD patient. Okay, and the third for obesity patient. For adults, use 5 to 10 milligrams a day and takes 13 to 60 minutes before meals. The dose should not exceed 13 milligrams per day. Okay, that's all for me. Thank you for your attention. I give you back to moderator. Thank you.
Thank you Abdul Hamid Muktiali for your explain about how amphetamine work and therapeutic is. Next part will be explained by my friend Muhammad Haidar Fadli.
Amphetamines are known to have a stimulant effect, which is a type of drug stimulate brain function and increases body activity. Amphetamines also to speed up body system to dangerous level, sometimes deadly, and can increase blood pressure, heart rate, and breathing. The effect of amphetamines related to abuse can be divided into two parts. The first is initial phase. During this phase, the short effect of amphetamine are determined by pharmacological effect and will cause happy feeling and increased energy. The second is continuation phase. A person will increase the frequency and thus to get greater effect from using amphetamine. The impact of amphetamine. The first is physical and the second is social. The first effect of physical in amphetamine is disorder in the lungs, mouth, heart, and skin. And the second is causes HIV and AIDS due to promiscuous sexual behavior. The social effect is the desire to have free sex areas due to the effect of drug which stimulate nerve, and hormonal metabolism.
That's all our presentation about amphetamine. Thank you for your attention. If you have any question, do not hesitate to let us know.